students, today we will discuss about the treatment plan of the cleft lip and cleft palate. In my last class, I have already mentioned in details the clinical feature and general knowledge of the cleft lip and cleft palate, and also we discussed in details about the types of cleft lip and cleft palate. Today we will discuss in details the treatment plan of the cleft lip and cleft palate. How will you treat the cleft lip and cleft palate? And this plan, first, because in clinical feature I have discussed that the cleft lip infant when born, there may be some breathing difficulty due to the incomplete development of the chin, that is called some symptom problem is there, and breathing problem that will cause fall of the tongue in the oropharynx or in the pharynx, so called choking of the upper respiratory tract, and sometimes during sleep or during feeding, that the feeding milk can be aspirated into the trachea and into the lung and cause respiratory pneumonia, and also asphyxiation of the upper respiratory tract will lead to the sudden death of the child during sleep or during feeding. So you must be very careful when the person or when the infant is born with cleft palate. This problem occurs, breathing problem mostly occurs when the child or the infant is born with cleft lip and cleft palate. The only cleft lip doesn't cause any breathing difficulty, but when it is associated with cleft palate, the breathing difficulty may be problem, and some symptoms that is the underdevelopment of the chin may also cause the breathing problems and falling of the tip of the tongue into the pharynx and cause choking of the child. And so this could be treated promptly, because it is the questions of life and death of the infant. So when there is underdevelopment of the chin and when falling of the tip of tongue backwards, then the child should be, or the infant should be nursed in prone position, and not only this, you can fix the tip of the tongue with the lower lip so that tongue should not fall into the pharynx, and then no breathing choking of the upper respiratory tract should take place. Another problem is the suckling. When patient is having difficulty in deglutition, and when suckling takes place, there may be aspiration of the suckled milk into the trachea and cause breathing difficulty, and in this way the child should be, or the infant should be nursed or given feeding by soft bottles or with the special tips. Sometimes we use the special palate formation for feeding of the cleft lip infant. So breathing problem can be cured or can be minimized by nursing the child in prone position. The feeding problem is also associated with the cleft palate. Not one cleft lip is not associated with feeding problem or sucking problem, but when cleft palate is there, the negative pressure during the suckling, negative pressure of the buccal cavity is not exerted due to the facts that the air it not become airtight due to the cleft palate, and air is leaking, and so sucking force is not created, and feeding problem will be there, and also there may be aspiration of the feeding milk into the trachea or into the upper respiratory tract. So I have already mentioned that the feeding should be done in such children, in such infants in prone position. The other problem takes place on the later condition when child becomes able to speak, and when this cleft palate is there, the phonation will be disturbed and the speech will be the nasal voice. Though when child used to learn to speak something, the phonation will be a great problem, and this phonation this problem, इसमें तो कोई दिक्कत नहीं है. This problem, speech phonation can be better done by the repair of the palate, cleft palate, and it should be done in 18 months of life, because the person or the child learn to speak at the age of 18 months of life. So a speech and phonation can be cured or can be treated by the better repair of the palate, soft palate or cleft palate should be repaired properly. Dentination problem is also there with the bilateral cleft lip or cleft palate, and dentination it should be treated by the dental surgeon and combined with the plastic surgeon in combined, and so the dentination problem will also be there in case of the cleft lip and cleft palate. The anatomical correction of the cleft lip and cleft palate, how will you correct the cleft lip and cleft palate? The time that when you should do the repair of the cleft lip repair should be the time, that is the rule of 10 is there, when the child is thriving and 10 weeks of life of infant. Weight of the infant should be 10 pounds, not less than 10 pounds, and the hemoglobin should be 10% at least for the complete healing or faster healing of the repair. So this is the rule of 10 for the repair of the cleft lip. Cleft lip should be repaired. Unilateral cleft lip should be repaired in the 6 months of the life of the infant, and if there is bilateral cleft lip, then it should be repaired first in the 4th month of the life, and next the 18 or 15 months of life with the palate repair. The cleft palate, when soft cleft palate of the soft palate, then it should be repaired in the 6 months of life of the infant, that is with the repair of the cleft lip. And hard palate should be repaired, cleft hard palate should be repaired at the 18 months of the life. But when soft palate and hard palate both are cleft, then the soft palate should be repaired at the 4th or 5th month of the life, and at the 18 month of life, that is at the age of 18 months, the hard palate should be repaired. But this one is the cleft lip, only repair should be done at 4 to 6 months of life. Only the cleft palate, 18 months of life, but soft palate should be repaired within 6 months of the life. But when the child is having both cleft lip and cleft palate, then what you should do? The soft palate should be soft palate, and lip should be repaired at the 6 months of life, and the hard palate should be repaired at the 18 months of life. And this principle should be followed, then you will get the better result of the anatomical correction of the cleft lip and cleft palate. So this is the principle of correction of the cleft lip and cleft palate. The principle of the surgery, the anatomical repair, is mainly 4 things that correct the anatomy of the cleft lip, anatomy of the side of the nasal bone on the side of cleft lip and ella of the nose, all should be anatomically corrected, because at the time or because in the cleft lip there is abnormality or ugly looking of the flattening of the nose is there, lip is cleft and widening of the face on the side is also there. So you should correct all the ugly looking side, that is the lips should be corrected properly, the nasal fold should be corrected properly, and then the nasal lateral wall of the nose should be anatomically corrected. And so these are the principles, and not only this, in case of the cleft palate, principle of repair is also the proper ventilation of the child, proper phonation of the child, proper feeding of the child, and taking these principles in mind, you should do the operation correction. That is, for the operation for the cleft lip is the most. One is the Millard operation. Millard operation, that is the correction of the cleft lip, the correction, vertical correction as well as the horizontal correction of the cleft lip should be done, and it should be done mostly by the plastic surgeon. But you should also know the principle of repair of the cleft lip, that the submucous tissue, they on the side of the cleft lip, the mucocutaneous junction, that is, it should be periosteal elevation of the lip, upper lip should be done on the cleft side, and then the lengthening or vertical lengthening is corrected, and the dissection should be corrected in 3 layers, that is muscle, mucous membrane to mucous membrane, and muscle to muscle, and then nasal mucosa to nasal mucosa. So in this way you can correct the cleft lip. Similar to that, in case of the cleft palate, that the operation is done by Wardell operation, that is the principle of this operation, that is the dissections of the both margin of the cleft palate, that the mucosa and periosteum should be elevated on the both side of the cleft, that is the margin of the cleft of the both side of the palate should be paired, and then some mucous elevation of the layer should be done, dissection should be done properly, and it should be lengthened, that is, it should be widened and approximated in the middle, and then the closure of the mucous membrane of nasal mucous membrane with absorbent sutures. They again the fibromuscular tissues of the maxilla should be approximated on the both sides, and lastly the mucous membrane of the buccal cavity should be approximated in the middle, and in this way the operation of the cleft palate Wardell operation is done. The principle is only to fill the gap, that is the gap between the cleft palate should be filled in by enhancing the layers, that is fibromuscular layers and mucous membrane layer in the middle, and stitching with the intraplate suture, and then this gap will be corrected, and the cleft palate should be repaired in this way. And other corrections should also be done in the later life, that is during the dentination, that at the time of the after the 1804 or 5, in the second year of life, correction of the dentination, and it should be consulted with the proper dentist, and also correction should be done by the dentist. The speech therapy should also be done for the correction of the phonation problem, and speech and vocational therapy. The infant or child should be sent for vocational therapy and speech therapy, and he can be trained in a better way how to speak the words and phonation correctly. And the others, after repair or after 3 or 4 months, just you can revise the anatomical correction of the cleft lip also, so that this correction should be looks better, and then revision of the cleft lip can be done if the anatomical correction is not perfect. Then you should try for the other operations, and some incomplete operations of the cleft palate and cleft lip should be repaired after 3 or 4 years of the life, for correction of the phonation, correction of the facial looking, sometimes prodding of the maxilla, and it also done by this way or that way, and then the complete correction of the cleft lip and palate, so the patient looks better, and ugly should be corrected properly. And in this way, this is the treatment plan of the cleft lip and cleft palate. So this is all about today. In my next class, we will discuss about the buccal mucosa, that is buccal cavity, that is carcinoma of the lip or carcinoma of the tongue or carcinoma of the buccal mucosa. Thank you. Okay.